First.
Hello, my name is Fran Dunn, and I'm the Physical Activity Coordinator with the Heart and Stroke Foundation of Nova Scotia. And I'm thrilled that you're joining us today for this intro video around Make a Move and the physical activity levels here in Nova Scotia. The Make a Move initiative is a partnership between the Heart and Stroke Foundation and the Nova Scotia Department of Health Promotion, Protection and Cancer Care Nova Scotia. We'd also like to thank the Nova Scotia Telehealth Network and Brian Fisher for their assistance in producing this video. The Make a Move program is offered nationally through the Canadian Fitness and Lifestyle Research Institute and is endorsed by the College of Family Physicians of Canada. We'd also like to thank many researchers for their contributions to the Make a Move program and add additions to their richness of the program. So the need for Make a Move arose when the program was identified after a comprehensive study with Nova Scotia healthcare practitioners on counseling practices. Healthcare practitioners self-identified a need for improved access to resources and counseling training on physical activity. The broad goal of the Make a Move initiative is to increase the quantity and quality of physical activity counseling by healthcare professionals in Nova Scotia. And it's important to note that these interventions are targeted at the apparently healthy, as screened by the Physical Activity Readiness Questionnaire, adult. So how much activity do we need? Well, we know that these guidelines were developed by the Canadian Society for Exercise Physiology and Public Health Agency of Canada. And depending on intensity, adults need between 30 and 60 minutes of moderate activity most days of the week. It's also important to note that these 30 to 60 minutes can be accumulated in 10-minute blocks and therefore can be comprised of different activities. The guidelines also recommend activities that improve balance, flexibility, and strength as well as endurance activities. But why physical activity? Well, we know that physical activity reduces the incidence of obesity, increases energy level and reduces fatigue, improves sleep, but also improves cardiovascular, muscular, skeletal, and pulmonary fitness, leading to improved longevity. We also know that those who are physically active regularly experience lower frequency and duration of colds and flus, have improved likelihood of independent living as they age, and also have decreased disability. Physical activity is also important for our mental health. As we know, 20% of Canadians will experience mental illness in their lifetime. And in Nova Scotia, we experience the second highest self-report of probable depression. The current prediction is that depression will be the second most prevalent disability cause worldwide. And there's significant evidence to show the link in preventative and therapeutic role of physical activity, particularly with regards to depression and anxiety, stress disorders, and schizophrenia. Physical activity also has a role in chronic disease prevention, preventing many of the large killers in our society, such as cardiovascular disease and stroke, cancer, diabetes, hypertension, osteoporosis, and shows improved health outcomes regardless of weight. Nova Scotians tell us they understand the link between their physical activity levels and their health. And yet, even armed with this knowledge, more Nova Scotians experience physical inactivity than any other chronic disease risk factor. It impacts the majority of other cardiovascular disease risk factors, including diabetes, obesity, hypertension, high cholesterol, and has a role to play in reducing stress and supporting smoking cessation. But what are the current activity levels in Nova Scotia? Well, according to the Canadian Community Health Survey, almost 51% of Nova Scotians aren't active enough for health benefits. This means that these Nova Scotians accumulate less than 15 minutes of moderate effort activity on a daily basis. We can further break down this data into the various regions within Nova Scotia and view the data per district health authority. I invite you to notice the activity level within your own DHA. If we break this data further into various genders and sexes, as well as age, we can see that men usually are more active than women, and as we age, we tend to be less active. Further data comes to us from the PACE studies. Notice how activity levels drop off as children mature to youth. we can see that less than 1% of grade 11 girls get enough activity for proper growth and development. These statistics are relevant and concerning, as we know that activity levels at this age are critical predictors of activity levels of this individuals as adults. But what is physical activity costing us financially? Well, we know in Nova Scotia, physical inactivity costs the healthcare and loss of productivity and premature death about $354 million a year. And if only 10% fewer people were inactive, it would save Nova Scotians $25 million. So what can be done to increase physical activity? Well, we know that efforts and interventions need to be coordinated at many levels and stakeholders to affect individual behavior change. An ecological model approach to affect behavior change is needed to support individuals on many levels to make activity the cultural norm. It's about making a coordinated effort so that the healthy choice is the easy choice. Healthcare providers are part of that team. They can motivate and assist patients to change unhealthy lifestyle behaviors, are viewed as a primary source of information and advice, and most Canadians visit their physicians approximately 4 times per year. We also know that even minimal level counseling can increase physical activity levels. Who are people listening to around physical activity? The public believes that healthcare professionals and physicians are a great source for physical activity information. There's a significant body of research to show us that physical activity is an effective way of promoting change on the individual behavior in primary care and clinical settings. And from this research, we know that successful physical activity interventions use a multidisciplinary approach, is stages changed, uses written physical activity prescriptions, links patients with community resources, and begins with interactive training opportunities. So if you'd like more information around how to join the Make a Move initiative, I invite you to browse our webpage at heartandstroke.ns.ca for dates and locations of upcoming workshops, or contact me. Make a Move training is accredited through the Division of Continuing Pharmacy Education and the College of Family Physicians. I thank you for your attention and interest in supporting Nova Scotians to become more active. Now let's make a move.